Hi everyone, my name is Dr. Colette Smart. I'm a registered psychologist and a professor of psychology at the University of Victoria in British Columbia, Canada. As of the time of this recording in 2025, I am also the scholar in residence for mental health and substance use at Island Health on Vancouver Island in British Columbia. And in my role as a scholar in residence, my mandate is to generate new research and also disseminate best practices, evidence based practices for the care and well being of people with complex PTSD. For many years, I've also had a private psychotherapy practice where I work with many different CPTSD survivors. And I want to acknowledge and respect the Lekwungen people in whose traditional territory the University of Victoria stands, and also where I live, work, and play, and the Songhees, Esquimalt, and Wasanic peoples whose historical relationships with the land continue to this day. So, I want to tell you a little bit about how I got involved with this very worthwhile and meaningful project. So Laurie Herod, who you will have seen in the other video, who's a founder and administrator of Out of the Storm. I met Laurie through our shared association with the Complex Trauma Special Interest Group of the International Society for Traumatic Stress Studies, or ISTSS. And Laurie put out a call for people to collaborate with her on creating this resource about closing the gap in healthcare, this gap between what survivors said they needed in terms of healthcare and then the healthcare that was actually being offered to them. And as soon as Laurie shared her idea, I became really excited about it, and it just made so much intuitive sense to me based on my own experiences in my clinical practice. I never set out to be a trauma therapist. Trauma sort of found me, but it was the thing that kept showing up in my therapy office. So I am actually a psychologist whose original specialization was working in people with chronic illness. I've done that for well over 20 years, specifically neurological illnesses like brain injury, stroke, cognitive aging, but also people with other catastrophic or life limiting illnesses like cancer, HIV, and chronic pain. And I started to notice in my practice a common theme that almost every single person was dealing with untreated trauma. Now, a certain amount of that was medical PTSD, like an acute classical PTSD from something that happened medically. But in most cases, it was actually complex PTSD that had never been diagnosed. And my clients themselves didn't even know that that's what they were dealing with. So it was a journey of mutual discovery for us to actually uncover that they had been dealing with complex PTSD all these years and never knew it. And for probably most of them, it was complex relational trauma, which is the theme of this resource and of Laurie's community. So almost everybody had abusive or neglectful childhoods. Some had experienced intimate partner violence. And then also many people had experienced racial trauma or intergenerational trauma. And so some years ago, I made the decision to move my whole approach to research to align with this intersection of medical illness and complex trauma. So, of course, the fact that Laurie wanted to create a resource at the intersection of healthcare and trauma was exactly something that I was very passionate about. For many years, I've taught and supervised clinical psychology graduate students here at the University of Victoria. And in my current role at Island Health, I teach and mentor frontline clinicians who are likely seeing many people with CPTSD in their clinical practice, providing education on trauma informed healthcare and best practices to support their clients. So Laurie's project just felt like perfectly aligned with the work that I'm currently doing and so passionate about. And just to share another thing about myself, which again really intersected with involvement in this project, is for many years, my main research approach has been something called patient oriented research, or PORE. And Patient-oriented research is unique insofar as the researcher makes a commitment to always have somebody with lived experience as part of their research team so that the research can be the most clinically applicable and relevant, and so that people who are affected by what you're studying actually get to share their voice in the design, data collection, and then dissemination of the research findings. So it really goes back to this mantra from the disability advocacy community: nothing about us without us. And so often what happens for myself as a patient oriented researcher is I will design a study and then invite somebody to be a patient partner. But in this situation, Laurie herself actually initiated the project. So this is really a step even further. This is a patient initiated and patient led research project. And we do also have a team of regular patient partners that worked with us on the creation of this resource. But again, it's unique insofar as Laurie was really the initiator and the leadership for this project. So, in closing, I'd just like to take a moment to thank all the wonderful people who made this resource possible. Of course, thanks to Laurie for having the idea and bringing it forward, to those of us who collaborated with her. I do want to thank Island Health on Vancouver Island here in British Columbia, and it was through their time and financial resources and support for me and my team that we were able to make this collaboration happen and this resource come to life. And so for that, I'm very grateful. I want to thank my team who worked on this, specifically Nika Marifat and Mitchell Gaudry, my two wonderful students who conducted the interviews, analyzed the data for the research study, and did the hard work of creating this platform on Canva to showcase the wonderful content that was generated by Laurie and the other team members. Um, I also want to thank Jessica Lazar and Malachi Gillican, both specialists and fellow members of the Complex Trauma Special Interest Group of ISTSS. And we also had a wonderful team of 6 patient partners who contributed their feedback and guidance to the direction of this project. And most of all, on a personal note, I would like to thank my clients who brought me to doing this work to begin with. All the survivors I have had the absolute privilege to sit with over the years and receive their stories and walk with them as they navigated some of the challenges in healthcare that are detailed in this resource. They've really inspired and motivated me, and I feel through us doing this work, we have an opportunity to pay things forward for Laurie, for her community, and all the other complex relational trauma survivors who have felt unseen and unheard in healthcare. So it's been my absolute pleasure, and I hope that you'll find this resource helpful.